Dear learners, welcome back to the channel. Today we are going to talk about how effectively approach pharmaceutics for competitive exam like GPAT and other pharmacy related entrance tests. We discuss about key concept, tips and strategy that help you prepare efficiently and score well in exam. Whether you are just starting your preparation or end of the preparation, this video has something for you, means helpful in your preparation. Remember, success in this field isn't just work. Remember, success in this field isn't just work. It's about smart work and believing your potential. Success in this field isn't just work, it's about smart work and believing your potential. All power is within you, you can do anything and everything. Keep moving forward, you definitely develop good career in pharmacy profession. So our today's topic is GPAT and other competitive examination preparation 2025 guidance lecture on pharmaceutics 1 subject. So pharmaceutics is a branch of science that deals with study of compounding and dispensing of drug. Pharmaceutics is a branch of science which deals with manufacturing of dosage form like tablet, capsule, emulsion, suspension, powder, cosmetics, sterile dosage form, etc. So that is the pharmaceutics. So in that section we learn about prescription, posology, monophagic liquid dosage form, biphagic liquid dosage form, emulsion and suspension, pharmaceutical calculations, powders, sterile dosage form, semi-solid dosage form, cosmetics and pharmaceutical incompatibility. So prescription is a written order of registered medical practitioner for nurse, pharmacist and patient. Postology is a branch of medical science that deals with study of dose that show the pharmacological actions. Postology is a Greek word. Posos means how much and logos means science. Monophagic, mono means single. Solution is one of the example, monophagic liquid dosage form. Biphagic liquid dosage form, emulsion and suspension means it have two phases. Pharmaceutical calculation, metric system and imperial system. Ancient system that is imperial system and today's that is metric system. Weight and measures. Powders, pharmaceutical powders, sterile dosage form or parenteral dosage form, semi-solid dosage form, paste, ointment, etc. Cosmetics that used for intended for beautification purpose, and pharmaceutical incompatibility means that compound is not stable, compatible each other, that is called pharmaceutical incompatibility. So one by one MCQ and concept we'll discuss about. So first prescription. Prescription, in that question will ask in the competitive examination, what does the subscription part of prescription include? What does the subscription part of prescription include? Patient name, so no. Drug name and dosage form, no. Dispensing instruction to the pharmacist, no. Direction for the patient. So correct answer is dispensing instruction to the pharmacist. Next, what does the SIG on prescription means? Signature of doctor, direction for patient, signature of pharmacist, signature of patient. So correct answer is direction to the patient. Next, what is prescription? Prescription, option A, that is written order from registered pharmacist. Second, written order for nurse. written order from registered medical practitioner, and fourth D, that is written order from any health staff. So correct answer is written order from registered medical practitioner only. Another, in prescription, RX means in that you take also correct and take to also. This answer is correct, that is C, both A and B. Inscription is the main part of prescription. It contains drug quantity, name, drug name, information, etc. Next question, structured evaluation of patient medication for improving health outcome is termed as hospital formulary, medication review, pharmacovigilance, medication error. So question is, that is structured evaluation of patient medication for improving health outcome is termed as, so that is medication review, correct answer, because pharmacovigilance, that study with adverse drug reaction, medication error, mistaken medications, and hospital formulary in that informations of dosage form, essential drugs, hospital formulary. So correct answer is, that is medication review. Next, who among the following is referred as father of Indian pharmacy? So Emil Stroff is a father of Indian pharmacy. Next, which part of prescription contain direction to the pharmacist? So answer is subscription. Superscription, it contain RX. Inscription, it contain drug name. Signature, it is direction to the patient. Subscription, direction to the pharmacist. So when we asking the question, first understand the questions, then eliminate the options, and then select the correct answer. So which part of prescription contain direction to the pharmacist? Subscription, not to the inscription, not to the superscription, not to the signature. Maximum times you have confusion occurs. Next, what is the meaning of Latin term gentaculum? Breakfast. So this type of questions will ask in prescription. Next, prescription parts details. Starting prescription, have seen the date, patient information, name, age, body weight, patient information. Superscription, RX, you take to. Inscription, refer the name of medication. Subscription, direction to the pharmacist. Signature, direction to the patient, and signature of prescriber, म्हणजेच registered medical practitioner. These are the prescription you have to remember. In prescription, superscription means RX, inscription means medications quantity, subscription means direction to the pharmacist, signature means direction for patient. Subscription, you know the remembering tricks, that is subscription. YouTube also subscription. So subscription means here in pharmacy, that is direction to the pharmacist. Subscription, when you seen in YouTube subscription, that times you have to remind that subscription means direction to the pharmacist, means that is a alternative remembering techniques. So subscription, direction to the pharmacist. So do not forget this. So prescription. Next, posology. Posology is a branch of science that deals with study of dose. Question is asked, that is posology primarily deals with which of the following? Drug interactions, drug doses, drug formulation, drug pharmacology. So primarily discuss drug doses. The B answer is correct, because drug interactions means when simultaneous administration of two drugs, one drug alters the actions of another drugs, means that is beneficial drug interactions or sometimes harmful drug interactions. Drug interaction means simultaneous administration of two drugs, one drug alters the actions of another drugs, result in action will increase or decrease. So that is the drug interactions. So posology primarily deals with which of the following? Drug doses, drug formulations, that is the branch of pharmaceutics that deals with formulation. Drug pharmacology, deals with effect of drug, pharmacokinetics and pharmacodynamics. Study of drug absorption, distribution, metabolism and excretion, and study the effect, that that is the pharmacology. Means how drug interact with living organism, that is the pharmacology. So posology deals with drug dosage form, that is you have to remember. Answer is B. Next, what is the purpose of loading dose? Option A is that is maintaining therapeutic level. Option B, rapid achieve therapeutic level. C, prevent toxicity. And D, reduce side effect. So correct answer is that is rapid achieve therapeutic level. So therapeutics level is important to prevent the disease. Therapeutic index, it is the ratio of LD and ED50, lethal dose and effective dose. Next, the therapeutic index of drug is measured in. Therapeutic index of drug is measured in safety. Correct answer is safety, not potency, not efficacy, not dose variability. Therapeutic index, it is the ratio of ED50 and LD50. Effective dose and lethal dose, means it measures the safety of drug. So remember the correct answer, that is the safety. Therapeutic index measures the safety. Next, when the actions and duration of action of one drug is diminished by the other, condition is known as. Diminished means changes or opposite. When the actions and duration of action of drug is changes or opposite by the other, the condition is known as antagonism. So why antagonism? Antagonism is oppose each other, two drugs when administered simultaneously. Addictions, cocaine, morphine, this type of drug you have cause addiction. Repeated administration of same drug, it cause addictions. Tolerance, repeated administration of same drug decrease the responsiveness of that drug, that is called as tolerance. So this answer is cancelled. Antagonism is the correct answer. Next, Clark formula for calculation of dose of drug is based on age. Young's formula, it calculate age. Clark formula, asking the question, Clark formula for calculation of dose of drug is based on. So age is Young's formula. Drug activity is not formula any. Surface area is also no, but body weight and pound, that is the correct answer. So Clark formula is used for body weight. B is the correct answer. Next, the adult dose of drug is 60 mg and the dose of 6-year old child would be how much? The calculation parameter. The adult dose of drug is 60 mg and the dose of 6-year old child would be. So here problematic questions, that is formula you have to remember. 6-year, age in years, Young's formula, age in years, how much age is given? 6-year. And child, Young's formula, what they said? Age in years divided by age plus 12. Age plus 12 means age is 6 plus 12 into adult dose. Adult dose is 60 mg. So 6 divided by, or 6 is cancel, 12 and 16 is remaining. 12, 16 is remaining. So answer correct is 20 mg. Next, the discipline which deals with effect of body. The discipline which deals with the effect on body, that is called pharmaceutics, pharmacokinetics, pharmacodynamics and toxicokinetics. So discipline which deals with effect of body. Pharmaceutics, that deals with formulation. Pharmacokinetics deals with absorption, distribution, metabolism and excretion. Toxicokinetics deals with toxicity, but it asks the question that is effect of body, drug effect. That is pharmacodynamics, discipline which deals with the effect on the body, means pharmacodynamics. Next, the dose and frequency of administration of drug is determined by dissolution rate, disintegration rate, half-life of drug, all of the above. So dissolution rate and disintegration rate is carried out tablet evaluation test. Dissolution rate, disintegration rate, half-life, a dose frequency administered drug is determined. So half-life is the correct answer. So this is questions asked in postology chapter. Next, decrease the responsiveness cannot be reversed by increasing dose is called. Decrease the responsiveness cannot be reversed by the increasing dose is called. So tolerance means repeated administration of drug that can cause decrease the responsiveness, but when we increase the dose, that shows the pharmacological actions. But the question is asked that is not reverse, means not show their actions. Idiosyncratic reactions means extraordinary response, means aspirin is used for analgesic purpose, but it shows a Rett syndrome. That is extraordinary response, meaning any drugs which shows extraordinary response, that is called as idiosyncratic reactions. So tachyphylaxis is the correct answer. Tachyphylaxis is the phenomena which when we increase the dose but cannot be show the pharmacological actions. Next, what is the dose paracetamol child having weight 40 kg, adult dose of paracetamol 500 mg. So this is also a problem, you have to use the formula and practice it. Next, which is not for primary treatment of poisoning cases, which is not for a primary treatment of poisoning cases. First, poisoning case, removal of unabsorbed poison, administration of antidote, elimination by excretion. Question is asked the primary treatment of poisoning case, not. So surgical operation is not primary step. So primary step, removal of unabsorbed poison, administration of antidote, elimination by excretion. But surgical operation is not a primary step. Next, Young's rule is used for. Or what is Young's rule? Child dose calculation, age in years, age plus 12 into adult dose. So question will ask this type of in posology. Therapeutic index is measured the safety. When the drug actions and duration of actions is drug is diminished antagonism. Clark formula used for body weight based on, and the adult dose of drug is 60 mg. The dose of 6-year-old child, remember the formula, age in years, age in years. So age in years, 6 years is given, divided by age plus 12, means 6 plus 12 into adult dose 60. So 6 plus 12 plus 6, 18 into 60. Give the 3 and 3 into 20. 20 is the correct answer. म्हणजे आपण सिंपली भागाकार दिला 6 आणि 6 प्लस 12 18 60 पुढे आहेत. एज इन इयर्स 6 plus 12 into adult dose 60. 6 आणि 12 plus 6 18. 6 1 6 सावित्रिक 18 and 60 3 1 3 3 2 6 and 0 means 20 mg is the correct answer. So this type of problems we'll have to need the practice. When we practice continuously, the answer will definitely got. Posology, it is a branch of medical science which deals with study of dose or quantity of drug which can administered to the patient to get desired pharmacological actions. So posology deals with dose or quantity of drug. Is a Greek word. Posos means how much, logos means science. Factor affecting changing in the dose action of drug. Age, sex, body weight, route of administration, time of administration, presence of disease. Body weight, route of administration, time of administration, presence of disease, genetic factor, environmental factors, idiosyncrasy, rate of elimination, synergism, antagonism, tolerance, tachyphylaxis, metabolic disturbance. So age, small child and old people require small dose as compared to adult, because proper, not small child not proper develop organs like kidney and liver, metabolism organ that is liver, and old people that is improper functioning. So that is the reason. Sex in male and female have different drug is required in pregnancy conditions. Body weight, higher the body weight, higher the dose is required. Lower the body weight, lower the dose is required. Route of administration, IV, oral route have lowest bioavailability as compared to parenteral. Time of administration, morning, evening and afternoon, this also affect dose. Presence of disease, so kidney diseases and liver diseases, that conditions dose will be need monitored. Genetic factors, environmental factors, emotional factors, idiosyncratic, extraordinary response, rate of elimination excretion, kidney diseases or any other. Synergism, when simultaneous administration of two drugs, one drug increases the actions of another drug, that is also called as agonist. Synergism also called as agonist, means increase the actions of another drugs. Antagonism opposes the actions of another drugs. Tolerance, repeated administration of same drug decrease the responsiveness of that drugs. And tachyphylaxis, repeated administration of drug result in block the receptor, means it does when we increase the dose but the drugs is not show the pharmacological action, that is the tachyphylaxis. Tolerance and tachyphylaxis difference, that is tolerance when we increase the dose that show the actions, in tachyphylaxis when we increase the dose but doesn't show their actions. And metabolic disturbance, diarrhea conditions, that conditions also dose affect. So these are the factors which affect or influencing dose and actions of drugs. This question will ask synergism, antagonism, tolerance, tachyphylaxis, metabolic disturbance, genetic factors, idiosyncratic. So you have to remembering tricks, that is Uspert, PG, year, sad, team. So when we the factors have not remembering, that's make a tricks, those are suitable to you. Next, monophagic liquid dosage form. Monophagic liquid dosage form, those dosage form have a single phase, solute and solvent. Solute and solvent, it form a solution, that is called as monophagic liquid dosage form. Syrup, you have seen in first year, that is the pharmaceutical syrup, manufacturing of syrup, simple syrup, that sucrose and water mixed to form a solution, that is called monophagic liquid dosage form. Which of the following is example of monophagic liquid dosage form? Example, that is solution, not suspension, not emulsion. Solution is the correct answer. Aerosol is a pressurized dosage form. So correct answer is solution, monophagic. And this question is, which of the following is the example of monophagic liquid dosage form? The answer is solution. Suspension and emulsion is a biphagic liquid dosage form. Aerosol is a pressurized dosage form or gases. Next, monophagic liquid dosage form questions will ask, which of the following is a monophagic dosage form? Solution. Next, following is a clear liquid preparation containing a low solubility drug solubilized by the means of proper solvent, usually alcohol. So mixture, linctus, emulsion. Emulsion also biphagic liquid dosage form, in which oil and water is mixed. Mixture, linctus. But elixir are definition said that elixir are clear hydroalcoholic solution. So elixir is a correct answer. Next, cold place as per IP indicate storage condition. Cold place as per IP 2 to 8 degrees Celsius is the correct answer. 8 to 25 cool. Next, which water is used for hand washing in a change room of pharmaceutical? Potable water. Next, Department of Transport test is performed by which of the following? Strip packaging, injection packaging, glass container, aerosol is the correct answer. Next, to be sipped or swallowed slowly without dilution is an auxiliary labeling condition for simple syrup, elixir, lotion. So linctus. Next, antibiotics is a drug that lower body temperature, kill infection, raises body temperature, is used to viral attacks. So antibiotics, it lower the body temperature. Antibiotics, not kill the infection, that kill infection, that is antibiotics. Antibiotics that kill the infections. Antiviral used in viral attack, that is antiviral drugs. The correct answer, that is lower body temperature. Antibiotic drugs that lower the body temperature. The agent which prevent multiplication of bacteria is known as bactericidal, disinfectant, germicidal, bacteriostatics. So agent which prevent the multiplication of bacteria. The question will ask, understand the first. Multiplication, prevent, bacteriostatic is the correct answer. Disinfectant, germicidal to kill the germ to kill the germ, bactericidal to kill the bacteria. But the question is prevent the multiplication, not the kill. So correct answer, that is bacteriostatics. Next, biphasic liquid dosage form. Biphasic liquid dosage form is have two phase. Substance means solute. Solution, when we think that is solution is a monophasic liquid dosage form in which solute dissolved in a solvent completely. But biphasic liquid dosage form in that solute is not dissolved in solvent, they have dispersed. So biphasic liquid dosage form in that example, that is suspension. Solution is a monophasic, syrup also monophasic, gel is a semi-solid. So correct answer, that is suspension. So suspension is a biphasic liquid dosage form in which solid is dispersed in a liquid medium. Coarse dispersion. Suspension is one type of dispersion. Coarse, colloidal and fine dispersion. Dispersion have three types: coarse, colloidal and fine dispersion. So coarse, particle size greater than 1 micrometer or 0.5 micrometer, greater than. Colloidal, so size range sometimes we will ask, or also question suspension asks, that is which cause irritation in eye. So suspension also cause irritation in eye when we applied. Okay, next, biphasic liquid dosage form questions. Which of the following dosage form are biphasic? So suspension, emulsion, these two are biphasic. Cold cream is also known as skin moisturizer, foundation cream, soft cream, skin protective. So cold cream is also known as, or is skin moisturizer. It promotes the moisture. Next, following ratio is used to preparations of emulsion. Following ratio is used for the preparation of emulsion, that is fixed oil water, gum 4:2:1, volatile oil water, gum 4:4:2. So correct answer, both is correct. Next, weighting agent HLB, hydrophilic lipophilic balance. Gripping is explained about hydrophilic lipophilic balance scale. So weighting agent, which is the range? 7 to 19. Hydrophilic, lipophilic. Starting 1 to 9, that is lipophilic, and remaining 9 to 20, that is hydrophilic. So question asks, that is weighting agent. 7 to 9, that is weighting agent. Next, phase inversion means change of phase. HLB temperature. What the phenomena of phase inversion means? Temperature means change the phase. Next, suspension follow zero order reaction, zero order kinetics. Next, particle size range, colloidal dispersion 1 nanometer to 0.5 micrometer. Colloidal. Coarse, that is larger, means greater than size 1 micrometer to 5 micrometer, greater than size, that is a coarse. Next, which of the following is not a antioxidant agent? Sodium bisulfide, sodium chloride, sodium metasulfide, sodium sulfate. Sodium chloride is not a antioxidant. Next, the more flocculated suspension will be the yield value higher. Next, sedimentation are formed slowly and the leading to a hard cake is deflocculated suspension. Next, different suspension can be compared by using rheological evaluation. Rheology, flow of liquid or deformation of material. Rheology is the branch of science that deals with study of flow of liquid or deformation of matter. Next, the role of borax in cold cream is an antimicrobial agent to provide fine particles to polish the skin, in situ emulsifier, antioxidant. Correct answer, that is antimicrobial agent. Next, drug in suspension and semi-solid formulation always degrade by zero order kinetics. Next chapter, that is pharmaceutical calculation, weight and measures. So weight and measures, that is two methods, imperial system and second one, that is metric system. Today's Indian pharmacopoeia. Our ancient old system, that is imperial, and today's, that is metric system. Imperial system, that two categories, again categories, outropious system and apothecary system. And unit, that is outropious in that pound and gallon, and apothecaries in the grain and gallon. Measurement of capacity in imperial system. The standard unit for capacity measure for outropious and apothecary system, gallon is the standard unit. Gallon is the standard unit for measurement of capacity. So you have to remember 1 quarts is equal to 40 florins. 1 pint into 20 florins. Metric system, standard kilogram is the standard unit. So this type of questions will ask, which is the metric system, which is the standard unit, what is imperial system, outropious, apothecary system. So you have to remember. Questions ask, if a pharmacist need to prepare 200 ml of 3% solution of sodium chloride, how many grams of sodium chlorides are required? 200 ml 3% solution of sodium chloride, how many grams of sodium chlorides are required? 3%, 100 in that 100 ml in that 3 gram, and 200 ml 6 gram is required. So correct answer is that 6 gram. In 100 3 gram and 200 6 gram. Next, to prepare 500 ml of 1% weight by volume solution, how much of solute is required? 1%, 100 1 gram, 200 2 gram, 300 3 gram, 400 4 gram, and 500 5 gram. 5 gram is the correct answer. Next, powders. Powder. A pharmaceutical powder is a mixture of finely divided drugs or chemicals in dry form meant for internal or external use. Pharmaceutical powder is a mixture of finely divided drugs or chemicals in a dry form meant for internal or external use. Powder dosage form. Powder compositions, classification and packaging. Simple and compound packaging, divided and bulk, granules, effervescent and non-effervescent, topical, cosmetics powder, medicated and surgical. Oral, in that powder composition, simple and compound, packaging, divided and bulk, granules, effervescent and non-effervescent, topical, cosmetics, medicated and surgical. So powder is used for internal and external use. Questions asked: which method is commonly used to reduce size of powder particles in pharmaceutical formulations? Which method is commonly used to reduce the size of powder particles in pharmaceutical formulation? So pharmaceutical engineering, in the chapter that is size reduction. Size reduction, in that reduce the size from larger into smaller ones. The phenomenon is called as size reductions. So question is here is asked, which method is commonly used to reduce the size of powder particles in pharmaceutical formulations? So size reductions, but the size reductions is also called as triturations. Mortar and pestle is used for trituration purpose. Levigations, pulverization by interventions. So all the above is the correct answer. Trituration, levigation and pulverizations is used for reduce the size, for improve the surface area and improve the pharmacological actions. That is the phenomena. Next, what is the primary reason for reducing the size of powder particles? Answer is to make option A is to make more stable, B is to increase the solubility, to improve the taste, to reduce the cost. So to make more stable is not correct answer. To increase solubility is the correct answer. To improve the taste also not, and to reduce the cost also not. So correct answer, that is increase the solubility. Another application of dosage form is meant for parenteral administration, oral administration, ophthalmic administration. Ophthalmic, eye drops, oral, tablet, parenteral, IV through. So topical, application of dosage form of powder meant for topical administration or topical application. Next, chlorinated lime is commonly known as bleaching powder. Next, which of the following is not used for preparation of baby powder? Boric acid is not used. Next, the statement store in cool place as per IP means for cool place, cold 2 to 8 degrees Celsius, cool as that is store any temperature between 8 to 25 degrees Celsius. Next, the record for the drug having date of expiry should be preserved for a period of at least 5 years. Next, emulsion. Emulsion is also biphasic liquid dosage form in which oil and water, oil is dispersed in a continuous phase. Emulsion are options given, that is heterogeneous system, biphasic system and dispersed system. So all the correct answer. Emulsion is a heterogeneous two-phase system, biphasic system also and dispersed system also. So emulsion are biphasic. Cold cream is the example of O by W emulsion, W by O emulsion, both, none of the above. So cold cream is the example of O by W. When we are applying the skin, that time they convert. Next, early sign of instability in emulsion is detected by. An early sign of instability in emulsion is determined by options: appearance of bigger size globules, separation of layer, appearance of caking and breaking. So option correct is, that is appearance of bigger size globules. Next, Auxiliary emulsifying agent stabilize the emulsion, adjusting the viscosity of continuous phase, changing the HLB value, strengthening the polar head of emulsion, strengthening the non-polar head emulsion. So auxiliary emulsifying agent is a surfactant which reduces the interfacial tension. So auxiliary, secondary, it can adjust the viscosity of continuous phase. Next, the blend between 20 and span 20 form is called O by W, W by O, milky multiple emulsion. Next is known as micellar solution. So micellar solution, microemulsion is known as micellar solution. You have to remember. In oil in water type emulsion, creaming occurs in creaming which reach upward, not to the downward. So creaming in oil and water type emulsion, the creaming occurs in upward, not downward. Creaming in emulsion is governed Gay-Lussac law, Newtonian law, Stokes law, Charles law. So in Stokes law is the correct answer. Determine the particles. Next, which of the following properties is characterized of microemulsion? Microemulsion. Micro means smaller the size. These are the transparent system with droplet size less than 1 micrometer. These are the transparent system with droplet size less than 10 micrometer. These are non-transparent system with droplet size less than 1 micrometer. These are the transparent system with droplet size less than 1 nanometer. So these are the transparent system with droplet size less than 1 micrometer. So microemulsion. Suspension. Suspension is a biphasic liquid dosage form in which solid is dispersed in a liquid medium. The question asks, that is, the direction shake well before use is given for powder, suspension, syrup, none of the above. So answer, suspension shake well before use is the direction given. Next, zeta potential is used for evaluating suspension, syrup, solution, all of the above. So not solution, not syrup, suspension, again correct answer. Next, milk of magnesia is common name for suspension of magnesium hydroxide, suspension of magnesium oxide, suspension of magnesium carbonate, none of the above. So milk of magnesia is a common name for suspension of magnesium hydroxide. Next, when the suspended particles are hydrophobic in nature, the formulation are hydrophilic means water loving and hydrophobic means water hating. Hydrophobic means water hating, wetting agent. Next question, structured vehicle include in the formulation of suspension in order to option A, prevent the cake formation, prevent the interfacial tension, prevent the sedimentation of particles, and D, none of the above. So structured vehicle include the formulation of suspension in order to prevent the sedimentation particle. During storage, crystal growth is observed. Fluctuation in the ambient temperature. These questions you have to verify. Next, which of the following is not an antioxidant agent? Sodium chloride is not antioxidant. The more flocculated suspension will be, the yield value is higher. Sedimentation formed slowly and lead to the hard cake is deflocculated suspension. And different suspension can be compared by using a rheological evaluation as a quality control parameter. Next, semi-solid dosage form, paste, cream, ointment, that is a semi-solid dosage form. Paste is semi-solid preparation which is concentrated emulsion, magma, gel. Magma is not, concentrated emulsion also not, gel is not. Concentrated suspension is a paste. Following is a true for paste. Paste are ointment. Paste contain high percentage of insoluble solid. Paste are used for protectable functions, and D, all. So paste are ointments also. Paste contain high percentage of insoluble solid. Yes, more about 50%, 60%, insoluble solid. Paste are used for protective function. Yes, D, all of the above. Correct answer, that is D. Next, the contain have highest amount of solid content. So paste have highest content solid, not ointment, not gel, not jellies. Next, fluoride content in paste not more than 1000 part per million. Next, in paste, the concentration of insoluble powder substance in 20% to 50%. So that is the correct answer. Means more concentration of insoluble powder is present in paste. Triple roller mill is used for preparation of ointment, paste, and cream. Ointment, vitamin A and D ointment is useful in the treatment of minor burns and skin irritation. Rickets. So the vitamin A and D ointment is useful in the treatment. So you have to also check or read in book. Next, lanolin is an example of oleaginous base, emulsion base, absorption base, water soluble base. So lanolin is absorption base. Vanishing cream, vanish, name indicate vanishing cream. Vanish means disappearing cream. Vanishing cream is an ointment that may be classified as water soluble base, oleaginous base, absorption base, and emulsion base. This is water soluble base, right? Ointment base having pH 5.5, 7, 7.5, 40. 5.5 is the correct answer. Which of the following is not a semi-solid dosage form? Paste, cream, and ointment. These three are semi-solid, but suspension is a biophysic liquid dosage form. So correct answer, that is D. Not. Answer is asking not. Most widely used hydrocarbon base is semi-solid dosage form. Petroleum and mineral oil, both are used. So base used for prepare antibiotics ointment. Oleaginous base, prepare antibiotic ointment. Oleaginous base, water soluble base, absorption base, and emulsion base. So you have to remember this base, oleaginous base. Next, jellies. What is jellies? Jellies are transparent, translucent, and non-greasy semi-solid preparation. Jellies are transparent, translucent, and non-greasy semi-solid preparation is the jellies. Ointment, paste is a concentrated substance, 20 to 50% solids. Powder is internal and external. Use solid. Following is not true for jellies. Non-greasy preparation, semi-solid in nature, generally applied internally for systemic use, used for medication and lubrications. So correct answer, that is generally applied internally for systemic use. That is not correct answer. Which of the following is a semi-solid preparation? Cream, ointment, and gel. The jellies are generally water soluble, water insoluble, both A and B, and none of these. Jellies are water soluble. Ointment base is water soluble. Silica gel, macrogel, lipogel, hydrocarbon gel. pH of skin 5.5, 2.3, 7.4, 9.2. So 5.5, because 2.3 is acidic, 7.4 is alkaline, and 9.2 is a more basic. Thus pH is 5.5. Suppositories are meant for rectal use, oral use, topical use, parenteral use. So not oral use, not topical use, not parenteral use, rectal use. Which of the following is a hydrophilic base for suppository? Mesopol, macrogol, soap glycerin, both A and B is correct. Next, suppositories can be prepared by compression, trituration, solvent evaporation method, hot melt extrusion method. So compression. Another displacement value related to the manufacturing of paste, gel, pessaries, and ointment. Pessaries. Next, suppositories used for ear infection are called cones. Next, sterile dosage form. Sterile dosage form are those dosage form which free from microorganism. Isotonicity. Isotonic. Iso means same, tonic means concentration. Isotonicity can be adjusted by which method? Sodium chloride equivalent method, freezing point depression method, and none of the above. So isotonicity can be adjusted both sodium chloride equivalent method and freezing point depression method. Next, the term bioavailability means relative amount of drug that reaches stomach, small intestine, liver. A option small intestine, B that is stomach, and C that is liver, and D systemic circulation. Systemic circulation is the correct answer. Bioavailability, availability of drug in systemic circulation means blood. Next, the absorption of drug is not required when it is given by following route. IV route is correct answer, because oral is also absorption, intramuscular absorption, subcutaneous absorption, but IV route is not absorption. Directly drug reaches in systemic circulation. Next, oily injection is preferably given by intramuscular. Next, among the following preparation, which one will be the most irritating to the eye? Purified water, that is the correct answer. Most irritating to the eye. Among the following preparation, which one of the most irritating to the eye? Purified water, 0.9% sodium chloride, 0.7 chloride, 1% sodium chloride. So sodium chloride solution also irritation cause. Next, well closed container protect the preparation form. Contamination, loss during the storage, loss during the transportations. So all are the correct answer. Which of the following route of administration of drug is associated with phlebitis? Subcutaneous, intraspinal, intravenous, intradermal. So intravenous is the correct answer. Purity of water in injection is checked by conductivity testing. Water attack test is generally performed by USP type 1 glass, USP type 2 glass, USP type 3 glass, and all of the above. So water attack test USP type 2 glass. Next, parental product may be sterilized, packaged in bottle, pyrogenic, none of the above. Sterilized, parental product must be sterilized, main basic step. Cosmetic preparation. Cosmetics means those substance which is used for the beautification purpose. That is means cosmetics. Zinc oxide is used for as astringent is the correct answer. Zinc chloride is used as astringent. A drug that prevents the infections and deals with is called antiseptic. Cream are basically semi-solid emulsion, ointment, like none of the semi-solid. Creams are semi-solid. Vanishing cream, they are disappear after the rubbing or applying. Next, which of the following is not used anti-dandruff agent in shampoo? Zinc. Cold cream are O by W type. Next, incompatibility. Pharmaceutical incompatibility means the result of prescribing or mixing the substance which are antagonistic in nature, and undesirable product is formed which may affect safety, therapeutic activity, appearance, and stability of pharmaceutical product. It is of three types: physical, chemical, and therapeutics. Pharmaceutical incompatibility means the compound is not compatible. Pharmaceutical incompatibility, the compound is not compatible when two compounds mix each other. Types of incompatibility: physical, chemical, and therapeutic. So physical incompatibility again categorize insolubility, immiscibility, liquefaction, and precipitation. Chemical incompatibility, oxidation, reductions, and therapeutic incompatibility, wrong dose, wrong drug prescriptions. That times the occurs. Chemical physical incompatibility in that insolubility, immiscible of two or more liquids, emulsion, precipitation, it occurs due to the when is added to the solution. Resin in water produce precipitate. Liquefaction, certain low melting point solid when mixed together liquefy due to the formation of eutectic mixture. Example, camphor, menthol, thymol. This occurs. Chemical incompatibility, pH change, oxidation reductions. Types of chemical incompatibility based on chemical interactions, tolerated incompatibility and adjusted incompatibility. Questions asked. Pharmaceutical incompatibility. Which type of incompatibility occurs when one drug is reduces the effectiveness of another drugs? So effect. Chemical incompatibility occurs, oxidation reductions. Physical incompatibility occurs, immiscibility, insolubility, liquefaction. But it question that is which type of incompatibility occurs when one drug reduces the effectiveness of another drugs. That is the therapeutic incompatibility. Correct answer. Next, what happens during the chemical incompatibility? Two drugs form precipitate, a color change occurs in the drugs. One drug chemically react with another drug, altering the drug properties. Drugs separate into different layers. So correct answer, one drug chemically react with another and altering change the drug properties. So last, we seen different questions and answer. This type of questions will ask in GPAT, pharmacy officer examinations or any competitive examination. That type of questions will ask. So you have to practice, read the books, make the tricks, make the remembering, practice, preservations and determinations. Definitely achieve the success. So these are the strategy for GPAT examinations or any examinations. First, understand the syllabus. First, understand the syllabus. Second, prepare study plan. Smart plan. Smart work achieve means smart means specific. Specific, measurable, achievable, relevant and time bound. That is smart work. Focus on core topics. Practice previous year question paper. Take online mock test. Revise regularly. Stay updated. Join coaching institute. Stay healthy. Remember, consistency and discipline are the key of the success. Planning, time management. So first need the understand the syllabus. Second, prepare study plan. Gather study material. Focus on core topics. Practice previous year question paper. Take online mock test. Revise regularly. Stay updated. Join coaching institute. Means classes. If you want to join the coaching classes, then you have to join. But if you're not joining the coaching classes, also you have to success. So that is not you only have to join the coaching classes and you have to crack or achieve the examinations. So you have to need persistence, consistency and dedication. Definitely you have to achieve the success. Stay healthy. Remember, consistency and discipline are the key to the success. So understand the syllabus, prepare the study plan, gather study material, focus on core topics, practice previous year paper, take online mock test, revise regularly, stay updated, join coaching institute, stay healthy, remember consistency and discipline are key to success. So these are the strategy. So what you learn in today's we're discussing about different topics: prescription, posology, monophagic liquid dosage form, biphagic liquid dosage form, emulsion suspension, pharmaceutical calculation, powders, sterile dosage form, semi-solid dosage form, cosmetics and pharmaceutical incompatibility. Different questions we'll discussing, and last we're discussing about the strategy of GPAT or any other examinations. So thank you. Hope this video is helpful to you. Thank you. If you like the video, if you helpful, thank you.